We want to remind you that the core skills of giving compassionate care are embedded in your DNA. They're hardwired into your genetic makeup. The skill, the attitude of giving compassionate care to someone who is vulnerable is absolutely essential for our species to survive. Children have very prolonged infancies, and for our species to survive, it's been absolutely crucial that embedded deep in us is a basic instinct, a basic drive to care for, look after and support those who are vulnerable. Of course, there are other drives for territory, for procreation, for food, for people will fight for status, but you'll know that even on the battlefield, soldiers can show great compassion to their comrades, and prisoners, we know, can look after little animals very carefully. So that core genetic imperative to care for others is always there. It presents itself, you can see it in a body language that belongs to all human beings. When we respond to someone who is vulnerable and in need of care, it's very simple. We instinctively turn towards them. We lower our shoulders and soften our body language and lean in just a little bit, but not in a way that's intrusive. Our eyes soften, our face relaxes, so we give the body language of being at ease and completely unthreatening, and we're quiet. We're just there for them, just giving our presence, our undivided attention. Sometimes this is called whole body listening. And we all know how to do that. It's there, built into us. Sometimes, because it's compassion and care are taught by great spiritual leaders and great philosophers, it seems as if to give compassion and care is a high ideal. But it's there in us all, just because we're mammals who need to care for each other. Giving someone that care of just being present to them, soft body language, soft face, quiet, just listening. Sometimes just 10 seconds of that is enough to reassure someone. A minute can be the greatest gift in the world to them. I was working with some nurses once, and they became very clear about the fact that there are some shifts where somebody's ill, they're on their own, they have their clipboard, there are 10 patients in the ward that need to be looked after, they have a timetable, things are very fast and intense, but the moment that a patient presents some distress to them, the good nurse, the good carer knows how to just simply pause and give the person attention. Soft body language, listening. At the same time, their minds are alert, thinking about what possibly might need to be done, but they're fully present to the person they're caring for. So please be reassured that you know how to do it. Sometimes, of course, you may be exhausted or irritable, and sometimes there may be even more powerful emotions towards the people you're caring for, but they will pass, as we all know. And you'll come back to this simple ability to just soften your body language, listen, and be there.